A recommended speech. A recommended speech by Cho Seung yeon. Congratulations on the compilation of the citizen movement history for Seongnam Citizens Medical Center, which was created at the initiative of citizens. The construction of Seongnam Citizens Medical Center was an important inflection point to dream of normalizing Korea's healthcare system. The wishes and will of Seongnam citizens created a miracle in the dark days when public hospitals were sold and closed with a distorted view of chronic deficits and inefficiency. Seongnam Citizens Medical Center is completely different from the formal public hospitals. It is the first hospital in our history to be established under the ordinance of the Residents' Initiative. The owner of Seongnam Citizens Medical Center, which was established with Seongnam City's own finances built by citizens' needs, is a citizen. In addition, it is the first hospital built in a large size, with more than 500 beds, in a convenient location for sick people in the center of the populous city center. In Korea, modern medical care was introduced in the midst of the turbulence of foreign power, and among them, Japan's private-centered medical system, which is the least public, was transplanted, failing to create the soil for public health. The post-liberation government also added American commercial healthcare to its existing colonial system, and neoliberalism, which prevailed worldwide during economic growth, created a basis for further reducing government investment in public health care. The national health insurance system, which began in 1977, quickly settled down and contributed greatly to the treatment of national diseases, but in return, it accelerated the entry of large capital into the medical market, resulting in a commercial medical market that justifies overtreatment. Now it is the world's 10th largest economy, but our people's lives are not very happy. We see countries with the highest rate of giving up their lives on their own, young people giving up marriage and childbirth, and countless neighbors leading to breakdown due to the burden of family medical expenses. High economic power alone does not make the people happy. The task of the new government should be to create a happy country and a welfare state together. Healthcare is the most important factor for the continuation of a happy national community. This is because unhealthy people cannot support a strong community. There is no hope for the future in a country where healthcare is mobilized in commercialism for the pursuit of private interests. Public hospitals are responsible for the region, at the center of public health care, that is responsible for the health of residents, through the provision of essential medical services, such as responding to disaster infectious diseases, and implementing health care policies, as well as serving as a safety net for vulnerable groups. The role of local public hospitals is the starting point for strengthening public health care, and in this regard, the view of Seongnam City Medical Center is bound to be different. Seongnam Citizens Medical Center should be like this. First, it is a hospital where the owner, the citizen, plays his role. A system should be established to collect citizens' opinions and reflect them in operation. Secondly, it has to be the center of the local healthcare system. A medical system through cooperation and role sharing is needed, not a competitor for private hospitals. Third, you should become a leader in patient-centered care by providing standardized care. It should be a hospital that pursues the original value of health care, that considers the patient's health before the outbreak of disease, and puts the patient's health before profits. Fourth, we need to have an efficient operating system. We need to take away the image of neglecting our seniority and create an innovative organization that values our precious taxes. Finally, we need to create a healthy employee culture. We need to create a workplace culture where we can enjoy competition in good faith that corresponds to stable employment. We need to create a workplace where employees with a sense of mission to commit to the public enjoy working. Seongnam Citizens Medical Center is not one of many public hospitals. It is a big work created by the sweat of countless people who have been striving for decades to put public health care at the center of national health care. No matter what the ordeal may come, the countless eyes that keep an eye on Seongnam Medical Center will pray for Seongnam Medical Center to become a big milestone in the history of public medical care in Korea. Once again, I would like to express my deep gratitude as the first president of Seongnam Medical Center to those who have worked hard to compile the valuable Seongnam Medical Center establishment movement history. I hope that the precious history recorded in this book will be used as a model for many local public hospitals to be built in the future, taking over the success and failing parts as a mirror to serve as the foundation for a happy welfare state for all citizens. Cho Seung, the first president of Seongnam Citizens Medical Center, the president of Incheon Medical Center, and the chairman of the National Association of Local Medical Centers.